Tidelands Community Care Network is an access health program that our health system brought in 2012, and so we are celebrating our 10-year anniversary. And with that, we've worked with over 7,500 individuals to connect them to primary and specialty care in our area. So we work with both the underinsured and uninsured to make sure that they have the resources to not only navigate the health system, but also look at the social determinants and barriers that might be impacting whether they are going to their appointments, whether they're able to understand what their prescriptions or medications are saying, and really understand what the resources are in the community that can help them have a better health overall.
What we've learned over the years is health isn't just about having a doctor or an emergency room or a surgery, right? It is about food and transportation, a home with air conditioning and a roof over your head at night. And so I think that's the beauty of what this organization's done, and I think it's done well over many, many years, is help people get access to whatever it is they need to have better health and a better chance at a nice life.
Being an FQHC, and of course having a population that we serve that are the uninsured and underinsured, there's so many gaps that still remain in terms of the health care that the populations that we serve receive or are able to connect with. Through the network, we were able to provide those additional services, especially around specialty services.
I think one of the things that makes me most proud when I think about the work that we do here at Tidelands Health and with our community partners is those, I'll say, non-traditional or non-typical ways we approach things. So some of the work we've done has been around physical fitness, helping kids to get bikes, working with community partners to make sure those kids understand how to use those bikes, helping families to get access to food, being there at distribution points to make sure that we're become that trusted partner too, right? So we want to work in the community with the community.
So I've worked in an array of health systems in the area. One, I have provided care at our local jail as the nurse. I have provided care at our local school as a school nurse. I have worked at one of our, two of our skilled nursing facilities in the area. And I can tell you right now, the thing that stands out to me most is those are all different entities, but Tidelands Health is in every one of those entities. So we have a place in the school with our programs. We have relationship and partnerships with the skilled nursing facilities in the area. And there is not one person that can come through this program as a participant and end up at jail, and we don't usually find out, and we are still able to assist the person. They will let the care coordinator come in and do what they need to do to keep them medically safe.
So I think that Tidelands Health has really prided themselves and really worked to become a health system that is able to provide care across the continuum. So we really are trying to work on that preventative front end to try to avoid and prevent people from having to see us in an acute setting. So that is unique, and the investment that this health system has made in community health resources alone is something that makes me really proud as the director of this.
You know, I think it feels good to be able to get out and reach people, and it feels good to be able to leverage our partnerships as we do that together, and to know that we are trusted, and that we're looked to for resources, we're looked to for advice. It's the excitement that I see on the faces of our team members when they're out doing a food distribution or helping with a community garden or working with kids at an elementary school, or it's just knowing that we can expand our reach.